clarify our confusions regarding these postpartum queries. Over to you, ma'am.
Thank you, Simi. When it comes to delivery, I don't know how it is here in Kerala, but then we doctors have to fight with the astrologers. They'll come with a date and time, and whether it is convenient for us or not, we will have to start the induction at that time, we'll have to deliver at that time. So that's a constant fight between the doctor and the astrologer. But after delivery, it is a fight between the doctor and the grandma. Because my grandmother says this, my mother says this, and then she would have more comfort in what the grandmother says, and many women do get confused as to whom to follow. Now, the best thing is to become friends with the grandmother and convey whatever message you want to the grandmother so that it goes down the line. Now, basically, I want to bust some myths about postpartum care. They say you should not drink a lot of water after delivery, and this is there everywhere. Water intake is crucial for new mothers, and it's important that they stay well hydrated. Minimum 3 to 4 liters is required to have a good lactation, to be hydrated, and to avoid constipation. The second myth is about the diet. Like Simi said, kanji, olaka chakra, lehiam, and a host of others that is followed in Kerala. Some have only bread the first 3 days and come back terribly constipated. There are women who are given lots and lots of ghee in the postpartum period, and that is another myth. The third and fourth and fifth myth include breastfeeding will come naturally, don't worry, you don't have to do anything more. Bind the tummy or you'll be done with a big belly for the rest of your life. Breastfeeding mothers cannot get pregnant, and this is belief that many women follow. Don't think about weight loss during this lactation period because dieting will lower the quality of your milk. So these are some of the myths. We'll start with sleep. How much sleep? Sleep when the baby sleeps. And sleep when the baby is playing also. Only get up if the baby is crying and demanding your attention. Relatives, visitors do come home to see the mother and the baby, but we should make sure that they do not disturb the mother if she is sleeping. Do they need to have more dietary supplements? Yes, they need 500 more calories than during pregnancy, but less than 5,500 can decrease milk production. They'll need to continue iron and calcium as essential. Calorie-dense food, gon ki laddu, and here, lots of ghees in the lehiam, etc., that needs to be avoided. Even if they are taking the lehiam, anything, it is still fine as long as they're taking a healthy diet with a lot of vegetables and fruits. And there should be proteins at every meal, be it breakfast, lunch, or dinner. When should they start breastfeeding? Ideally, it would be immediately, or at least within the first hour. Every time the baby cries, one must remember, they keep on saying the baby is crying all the time. Yeah, baby cries, it's not necessarily due to hungry. Sometimes it just wants to be carried. Or it might be having some tight socks on his feet. So don't think that the milk is insufficient. Galactogogues are good, but they are not compulsory. What problems to anticipate with breastfeeding? Insufficient milk. We only need to reassure, give them a good diet and a lot of emotional support, and they should have a positive mind that they will be able to feed, and that works a long way. Retracted nipples need to be detected, and they need to be told how to manage them. Cracked nipples and breast engorgement need to be monitored. Now, how can working women, they need to go back to work because most women are working these days. How can they exclusively breastfeed for up to 6 months? Option is, take the baby to work, feed the baby. We all did when we were working. So they can do it differently. Have a helper to bring the baby to work, or you can come home during the breaks. If none of this is possible, they can express the breast milk, save it to be fed by a caretaker, maybe their mother, grandmother, or somebody who's there at home, to cup feed, not bottle feed, because bottle feed can bring in infection. Express milk can be safely stored for later use at ambient room temperatures for about 6 hours and in a refrigerator for 3 days. They only need to be labeled, and the time that has been collected has to be mentioned. Now, postpartum discharge. We know that lochia is a mix of blood mucus, and it has got one stale, musty odor. It can last several weeks, and it can be heavy at first, but laterally it becomes slow. Usually it can go for 6 weeks, sometimes it can be longer. She needs to report if it becomes foul smelling and is associated with pain and fever, which indicates infection. Now, what medicines to continue the postpartum period? Iron and calcium should be continued for all women. And if they have been prescribed, supposing she is a hypertensive woman, antihypertensives, antibiotics, thyroid, thromboprophylaxis, any other drug depending upon what we wanted to take. When can they start exercising? Now, ideal would be 4 weeks after normal delivery. Why not earlier, you might ask? Because, their muscles are under the effect of relaxin. So, we don't want them to go do a jog immediately after delivery. But having said that, simple exercises can be done. Targeted toning can be done. Strenuous exercise need to be avoided. Walking, deep breathing and abdominal contraction can be done at all the time. Now, I don't want to go through the benefits of exercises. Many women say that they are too tired, they have not got enough sleep, and they don't have the time to exercise. All I will say is that exercising, in fact, increases the energy levels, it improves their sleep, and it even improves their lactation. It decreases the bone loss. Now, are pelvic floor exercises compulsory for all women? Yes. They help to tone the pelvic muscles, which are particularly stretched during vaginal delivery. That doesn't mean those with cesarean need not do pelvic floor exercises. They also need to do. Postpartum weight loss, it takes about 6 months to a year to return to pre-pregnancy weight. Half that weight is lost during the first 6 weeks. But then healthy diet, rich in vegetables and very little trans fat. Watch very less TV is what I say. If you are sitting for more than 15 minutes in a place, that means, you are trying to gather weight. NEPA, somebody asked me what NEPA is. It is called non-exercise physical activity. Just going to reach the door, somebody comes home, rings a bell, opening the door, going and getting, fetching things. All these are small activities which can add up to a lot when it comes to postpartum weight loss. 40 minutes of physical activity is all that is required. Walk. Walking can be done even inside the house, and this many people learned during the COVID times. When can she resume sexual activity? Preferably after 6 weeks. Wait at least 2 weeks after delivery, not before that. Many women can ovulate by the 4th week after delivery. Avoid another pregnancy for 18 months. At least 1.5 years gap should be there. But at least give a 6 months gap. Safe to use contraception. Now, according to the MEC, immediate postpartum, copper T would be the best. LNG IUCD also can be used. From immediate postpartum to 3 weeks, ideal will be a progesterone-only contraceptive, which can be either a pill or DMPA or an implant. And more than 3 weeks to 6 weeks onwards, it can be, even a COC can be given if required, but preferably a progesterone-only contraceptive, which moves from 2 to 1. So these are the contraceptives of choice. Now, when to seek medical help is something that is extremely important, and we need to print it in all our discharge summaries, even after a vaginal delivery. Bleeding and soaking through more than 1 pad an hour, or blood clots the size of an egg or bigger. When they have swollen and painful breasts, they come much later after an abscess has formed. So we need to tell them about that. A red or swollen leg that's painful or warm to the touch. Temperature more than 100, they cannot say, I will take one Dolo and sit at home. A headache that doesn't get better even after taking medication. I had a patient who complained of headache and blamed it on no sleep, and later on it turned out to be something different. Even after taking medication or a bad headache with vision changes, flu-like symptoms, or any sudden vision problem. What is an emergency? You have to tell them about this emergency. When they have chest pain, or when they have difficulty in breathing, or when they have seizures, they have to run to the hospital in an emergency. Another emergency with many women, many obstetricians don't think of, is the thought of hurting herself or the baby. This we need to tell them, that whenever they get this kind of a thought, they need to run to the hospital. So this is our advice to the postpartum woman in hopefully 7 minutes. Thank you very much.
Thank you, Susheela madam. Simi, will you please conclude?
So to conclude, the sedentary behavior of the postpartum women should be discouraged. Instead, encourage them for regular physical activity. Even the WHO recommends 30 minutes of walking can be encouraged during the per day at least 5 days a week, and not continuously 30 minutes, 10 minutes walking at various intervals. And what the mother eat and drink determine the quantity and quality of the milk. So encourage them to have a nutritious diet which is rich in proteins, vitamins, iron and calcium. Hydration, very, very important. Express breast milk is an option for the working women who needs to have exclusive breastfeeding. The sexual activity can be resumed 6 weeks after delivery, but make sure they use adequate contraception. Thank you. Thank you, Susheela madam.
Susheela ma'am and Simi, please join for a photo at the photo point. Next, we have a topic on Robson's. When we think whatever we do is right always. Whatever indication I did was right always. Is there any need for auditing ourselves? What is the importance of having this Robson in all our cases? To talk on this, we have Chitra madam, she's my own teacher, and Amy in conversation. Over to Amy for introducing the topic.